All right, how cool is this going to be, you guys? We've got London and Los Angeles, and Switzerland, I believe, right here. So this is our welcoming you to our Leaders Who Care series. Leaders Who Care series, really brief, is a series, a video podcast, whatever you want to call it, where we have been recognizing and highlighting leaders in corporate world, in foundations, nonprofits that really get the point that their businesses, their organizations, their families, everything can do way better economically when you're doing good at the same time. And there's a lot of that going around, thank goodness. And I believe you guys are going to show that you are leaders who care. And this particular series, and we saved the third part of the series for the best. I hope the other guys aren't listening on the first two episodes. And it's about the why, where, and how of work. And this specifically about, what populations, what people have to be taken care of more or have to be looked at with respect to where they work, how far they work, and how that's impacting, what's going on. So I'm delighted to welcome Art and Arthur to our table. And I'm even more delighted to introduce you and everybody again to my incredible co-host from Zurich, who will take it from here, and then we'll get into a whole conversation. Cynthia.
Thank you, Mark. So Mark and I have been talking quite a lot about this whole narrative of how we work, where we work, the interplay between the kind of work we do and where we do it. So we've talked to people about being global nomads. We've talked about the return to bricks and mortar. We've talked about the reshaping and rethinking of bricks and mortar. And one of the things that we wanted to really explore in this one is the idea of proximity and how much does it matter if you can work near where you live. What are the implications for quality of life? What are the implications for social fabric and community? And there's certainly been a lot around essential workers, whether in healthcare or other fields, and what that means and how that impacts global planning or urban planning and kind of global society. So we just really wanted to open this up. So I'd like to just first introduce you, and then we'll kick off the conversations. So Art, would you like to introduce yourself?
Sure, happy to. And it's morning here in Los Angeles, so I'll say good morning to everybody. I'm Art Ochoa, and for the last 23 years, I have been at Cedars-Sinai, which has evolved to be a academic health system serving the broader Southern California region and the many, many millions of people who live in our region. And beyond what we do to care for people in Southern California, we are also a global destination for clinical care, and we see patients from all over the world, including large volumes of patients from Latin America, Southeast Asia, and the Gulf. I'm a lawyer by training, and in a prior life, I was proud to count Cedars-Sinai among my clients. And my background is that of transactional law and tax. And my role at Cedars-Sinai is I'm the Chief Advancement Officer, and I am responsible for things like our fundraising, our community benefit strategies and activities, our health equity efforts, and for about a decade, I was responsible for all of our marketing and communications efforts as well.
And you have a family, right?
I do have a family, and both of my daughters were born at Cedars-Sinai. My wife was born at one of our predecessor entities, Cedars of Lebanon. My older daughter had graduated from college, was living and working in Manhattan for one of the Bloomberg philanthropies, and has decided to move back to Los Angeles. And so she's been home for about a week as she looks for work in the immigration reform space. And my younger daughter is a junior at Skidmore College in upstate New York, where they do play hockey, Mark.
Yes.
She doesn't play hockey, but they have a serious hockey team at Skidmore, as you probably know.
It's a lot of serious female hockey players, but that's another episode.
Indeed. Arthur, tell us about yourself.
Hi, everyone. My name's Arthur Kay. I'm really thrilled to be talking to you all today, Cynthia, Mark, and Art. Mainly because it's around the kind of the how, as you mentioned. It's often people can get very stuck in the kind of the macro themes without delving into some of the specifics, and so really excited to be talking about some of those today. My day job is running a company called Skyrim, of which I'm the founder. And at Skyrim, our focus and interest is exactly around this subject. Our mission is to try and deliver new homes for key workers near to where they work, specifically so we can try and essentially improve the quality of life for key workers, but then how that relatively small intervention has a massive cascading effect throughout society, in terms of that these are typically the people who are providing fundamental services, and who, unlike I think some of your previous podcasts, need to be near their physical place of work in order to actually perform their duties, unlike knowledge workers, for example, who can often have a hybrid or even remote working pattern. And so that's really our focus around kind of proximity, temporal proximity, as well as often physical proximity to the place of work. And the challenges that key workers are facing are very specific to typically urban centres, and about how that can be unlocked. So really looking forward to diving into the discussion and talking about how we're playing a small part in tackling that here in London.
And by the way, do you have a family?
I do not. I am, maybe one day, but for now I'm just me. I've got a small cat, but other than that, it's just me. Yeah.
That's awesome.
Fantastic. So actually at the Innovation Foundation, we've been looking a lot at this issue of who's being left out of that narrative on the future of work, and the need to really get into communities and hear what the needs are, and shine a light on people who are not usually part of that conversation. And certainly essential workers, frontline workers, key workers, who are part of that. So I would love to hear more from both of you about what are you hearing from the front lines, particularly Art, in your case, from the healthcare side, and Arthur, what are you seeing in terms of being able to, say, take healthcare workers and allow them to work closer to where they live, or vice versa?
Yeah, well, I mean, from our perspective, it's looking at, because often what's spoken about in the press and in the UK, we've been suffering, there's been a lot of industrial action, particularly in the healthcare section, for typically pay and conditions are often what's levied. What we try and do is listen to those headlines and delve one layer underneath that. And when you do so, you see that there's been, I think, half a dozen strikes in the last 12 months here in the UK, for example, throughout the NHS. When you delve into pay, the definitions of what is called housing poverty are based around what percentage of take-home income you spend on housing. And the facts when it comes to a healthcare worker are extraordinary. Typically in a city like London, they're well over 60% of their take-home income is spent on housing. And then you can add on top of that anywhere between 5 to 15% on top of that for commuting and work-related travel. So if you look at that from a housing poverty perspective, people who are working for the NHS or whichever public health body it happens to be are spending a huge amount of their take-home income on housing and traveling to and from work. And so is the question, obviously pay is the thing that people obviously jump to, because if you can earn more, then you can, in theory, have more disposable income. We're trying to look at that from the other side of that same coin, about saying if you can reduce your cost of commuting through proximity, maybe a walkable or a short cycle or public transport to get there rather than using a car or long commutes. Typically a healthcare worker in a mega city will commute for about 2.5 hours a day, which is an extraordinarily high number in my opinion. And then on top of that, if you can reduce the cost of housing through either government interventions or in our case, kind of typological interventions, then you can try and essentially achieve the equivalent of a pay rise through increasing that percentage of take-home pay. So in this case, it might be taking it from 35% in terms of kind of take-home pay that can be disposable income up to, say, 50%, which is a material difference in terms of quality of life. So that's kind of our interest about how we're beginning to look at this.
Yeah, for us, a couple of things. First of all, I think what you're doing is fascinating, and I'm really interested in learning more. we at Cedars-Sinai and more broadly in the healthcare sector have a challenge, and that challenge, as you've described, I think in the premise of the question, is that there are a significant number of people in our workforce, and our workforce across the health system is 20,000 people. There are a significant percentage of people in our workforce who really don't have the option to work remote or hybrid. The nature of their work is on one of our campuses, and obviously that's not just nurses, although nurses make up the plurality of the job descriptions in our workforce. It's everyone from the environmental services workers, which, once upon a time were called janitors, but obviously are doing more things than that. And environmental services is probably the appropriate description. Parking attendants, all of our allied health professionals, respiratory therapists, pharmacy techs, and the like. And I will tell you, I'm regularly in conversations with physicians on our medical staff who also talk about the challenge of very long commutes and affordability in communities proximate to our urban centers. It is an interesting challenge that on the one hand, job opportunities tend to exist where large numbers of people live, and where large numbers of people live, real estate prices and housing tends to be very expensive. We have a huge number of people in our workforces who commute more than net 2 hours a day. 2 hours. There are people I know, people who work on my team, people who have nearly a 2-hour commute each way to work. And what's interesting, though, to us is that they pass a number of other like employers from their home to here, and people, in a free market, choose to work here. And so I have to say, while that's a blessing, and we are really proud of our extraordinary people who work at Cedars-Sinai, and we're very picky about whom we pick to work with us and whom we retain and all of that. On the one hand, there's another side to that coin, and that is that lots of it. I'm not singling anyone out, or including my own institution, but just thinking about market forces. On the one hand, if you've got people who are making long commutes and passing a lot of potential employers on the way to work, and they still come to you every day, that doesn't necessarily light a fire under any employer to look at as many creative solutions to housing as they might if they had a workforce shortage problem.
Yeah, that's true.
Yeah.
But what about
I could jump in
retention?
for a second.
Oh, sorry.
I've noticed is you've sometimes, and other healthcare systems too, gone the opposite route and maybe acquired a hospital farther out and brought the hospital closer to the people rather than the people closer to the hospital.
That's right. We have, and when we've done that, we have certainly had people who work at, say, the flagship, which is here at the intersection of Beverly Hills, West Hollywood, and Los Angeles, in the western part of Los Angeles, and said, you know what, I'm raising my hand. I'd like to work at one of those other facilities because it's closer to where I live. And sometimes we've been able to accommodate them, and sometimes we've not been. But yeah, I mean, look, as the population continues to sprawl in Southern California and in all urban centers, the idea that everybody, patients, I mean, look, we exist for the sake of our patients from the region and from around the world. You can't always assume that people are going to be willing to come to you for, even the simplest stuff if it's really hard, if it's a long drive, and if we make it hard for them to get here, which is one of the reasons why we do have the reach that we do, and we have the hub and spoke system, and the really complex tertiary and quaternary stuff will still come here, but other things can and should be treated in local communities.
To put some, that's really interesting, Alison. That hub, I'd love to learn more about that hub and spoke model. To put some I guess, data behind what we, I think, all intuitively know about things like long commutes. Probably one of my favorite studies, appropriately from the University of Zurich, is called the commuting paradox. And one of its key findings was that a 1 hour reduction in commuting time was worth the equivalent of a 40% pay rise in terms of reported levels of happiness. And for a single person, it was the equivalent, the same as the equivalent of finding or losing a partner. So in terms of these, what would seem relatively arbitrary, significant reductions, but arbitrary in terms of you wouldn't necessarily think of something like commuting as having a material effect on your net happiness. That paper kind of talks about it in pretty material terms about how reported levels of happiness are changed with that. So that might kind of give some light into, let's say, on average net commuting times of 2 hours at your hostel. That could be a very good way to again give pay rises.
That's so interesting, because often companies will default to things like providing a shuttle service or subsidizing commute costs.
Right.
And so that if that's the case, then it's the time that's more valuable. So I wonder what you think about that.
And certainly above a baseline income level, I think that's right. I think that time has a value that is frankly more difficult to quantify, although Arthur has just cited a study that does exactly that. I think of my own example. I am lucky enough, and I am blessed with an incredibly short commute. This morning, I'm speaking to you from my office. I left my driveway, and 12 minutes later, not only had I parked, but I was unlocking my door to my office, and I recognize what a blessing that is, and increasingly a rarity. I was reflecting on just the other day. I was talking to a senior level faculty candidate at our academic flagship, and this is somebody who lives on the East Coast, and was lamenting to me that as he and his family were looking at housing costs, that it was going to be difficult for them to replicate their 10,000 square foot home. Putting aside whether or not anybody needs a 10,000 square foot home unless they have an incredibly large family, and I can't convert that to square meters. Sorry, it's too early in the morning for me to do that. But it's big. Rest assured, 10,000 square feet is gigantic.
It's about 1,000 square meters or so. Yeah.
There you go, 1,000 square meters. So I will tell you that I said, look, you could replicate 10,000 feet, but you will have a very significant commute on your hands, and at some point, look, you've got to make a decision for yourself, but I don't think it's worth it, right? I mean, at some point, you just got to make decisions about what's important to you. But I recognize that at the same time, there are people who are not senior faculty candidates who are talking about allotting discretionary income and deciding where to live and how big a house to have and all of that. But there are people who are making a lot less money and don't have those opportunities to make those kinds of choices, and they don't have a choice about necessarily where they can live, and that's increasingly a larger part of the broader workforce as inflation has taken hold really around the world.
Arthur, the model that you've got of repurposing a footprint in an urban center by building up and over existing buildings is really interesting. I hadn't seen that elsewhere. Just maybe you can talk a bit more about that and what the pros and cons of it are.
Yeah, so the company that I run is a company called Skyroom, and what we do is it's kind of zooming out of this problem. We looked at how you could kind of increase density near to where people need to be for a very specific group, i.e. key workers. And our solution, which isn't applicable in all cities around the world, but in a city like London or Los Angeles, would work very well, which is that you build new buildings in the airspace above existing buildings. So it's essentially looking to repurpose roof space by adding between 2 and 10 new floors above existing buildings, and then using that as new homes for key workers specifically. We're operating at the moment in London, and kind of our current partners include different NHS trusts and also a number of big landowners and local authorities and government departments. And it's around this idea of how you can, we call it incremental density. So we're not talking here about building skyscrapers in areas that should be low rise. It's around within the the existing planning context, looking to incrementally increase density in areas that already have very good transport links. So trying to not have people commuting by car, for example, can they find a way to commute through active travel, walking or cycling, or through public transport? And then around those nodes or those spokes, to use Art's language, can we increase that density to people can get to their place of work much more faster, basically, faster and less stressfully, because there's obviously there's a big part of this is around just stress. And I think I don't think you managed to finish the point, Cynthia, but earlier you mentioned the point around retention, which is, I think, the other part of this as well, in terms of can people do very stressful commutes for a few years? Probably, almost definitely, but can they do it for a long period of time? And again, referencing London at the moment, actually, this is actually a few years out of date. So if we look at post-pandemic, I'd imagine these figures are even higher. But in 2020, 62% of London's key workers were actively looking for jobs outside of London due to the price of housing as their number one factor. And 54% of London's emergency key workers already have to live outside the city and have long commutes in. So it's kind of a problem which mega cities like London, I can assume similar for Los Angeles and certainly other mega cities around the world, are already tackling with this as a active retention issue. And then, to your point, Art, market forces, that's going to just put an increasingly large cost on HR departments and on recruiters to be able to get that talent in.
Right.
It's fascinating statistics, and I'm not surprised to hear them, frankly. One of the things that I think that one of the barriers to implementing creative solutions like you describe, Arthur, is that institutions like ours and other, to just pick on healthcare, other healthcare institutions are being increasingly squeezed in the marketplace, right? I mean, you look at what's happening with the NHS in your part of the world too. That in our part of the world where we rely on commercial insurance to essentially allow us to cross-subsidize so much of the rest of the work that we do, and we are continuing to be squeezed by commercial payers on the one hand, inflation on supplies and the like are wreaking havoc with our budgets, and wage inflation is a very, very real thing. We don't have the kind of free cash that we might have once had, and for institutions like ours, that was true, that once upon a time we had more free cash. Although of the 6,000 plus hospitals in the United States, many of them are not in the position that we're in of having a positive net margin every year, although that margin has decreased. But regardless, we have less than we used to have. We are getting squeezed more and more on all fronts. And so as we think about implementing creative solutions, there are people, around institutions like mine and others around the country, probably around the world, that say, look, we've got enough problems right now. Yeah, we have all of the challenges of strained workforce, of a strained workforce and the like, but we can't afford to implement anything creative.
Well, who are other players in that ecosystem? So if you take something like insurance companies, is there anyone else that you think you could?
Well, so you're big.
Mm-hmm.
Go ahead. No, I'm sorry.
No, how could you create incentives for players like that to become part of the solution?
Yeah, I think it's a great question. And I'll tell you, you've got the commercial payers, you've got government is a gigantic payer through Medicare and the Medicaid system. In addition to that, there are, large academic health systems that have, teaching programs. And so, there are students. And so, they are a constituent, entity there as well. And in addition to that, I'll tell you that, just like you think about communities that have made decisions about it being important to have teachers live in the communities in which they teach, to have law enforcement live in the communities that they serve, to have, fire and, other, public safety folks live in those communities. The communities are a stakeholder as well. And, the question is it important to have for the communities? So I would say I would add them as somebody with who could or should have skin in the game too. Although, municipalities are getting squeezed too.
Yeah, related to that, and I think maybe this applies to both of you, Art and Arthur, is, I was discussing with an executive of CBRE the other day, what's going to happen to all the commercial real estate that's like out there type of thing. And I wonder, Arthur, if it's also above commercial real estate that you could do what you do, and even not just above it, but in it, the commercial real estate, and take it, and maybe the community take advantage of using commercial real estate that is not being used. On one floor, they put gardens and daycare centers. On the other floors, they add homes for people. And there's people like veterans, refugees. We work with formerly incarcerated, a lot of untapped talent that can do a lot of jobs that would actually look at something like that. What's your, as a partner, maybe a CBRE-ish, maybe could be a partner for something like that?
Yeah, absolutely. And yeah, it works equally well above commercial, and really using to bring in elements in terms of the kind of climate emergency here as well. A lot of buildings across the world are, the built environment emits roughly 40% of all global emissions. And so there's a huge amount of retrofitting of existing buildings that's required. And so a big part of our model is looking at underutilized assets generally, and how you can do two things: one, make better use of them, and two, how can you improve them to improve things like fire safety, environmental performance, and all of those elements at the same time whilst you're making that architectural intervention. So it's exactly right in terms of its that kind of instigator is important to then to be able to make a broader intervention within the building itself.
At the same time, and Arthur, you're much more expert at this than I. I have this vague recollection that I read something recently that suggested that in terms of repurposing commercial buildings for residential, for example, there were, I think it was the number was like smaller than 20% of them could be cost effectively repurposed, and that something like a greater number than 80% of them, it'd be cheaper to raise the building and start again. Is that true? And if so, how does that change the calculus, if at all?
Yeah, no, you're exactly right. I don't know the exact figure in the US, and 20% sounds intuitively right. A lot of that is not necessarily around the building materials and fabric. Without getting into too much technical detail of the architecture, it's typically around the way in which you design an office floor plate and how that interfaces with the building regulations and fire safety regulations of a housing floor plate. So kind of at a very high level, yes, it makes kind of total sense. You have an empty office, make it into flats. That happened a lot in the UK over the last 10 or 15 years under something called permitted development rights, which has had quite mixed reviews in terms of its success. Underutilized commercial can be changed without full planning permission into residential. The good side is exactly as Mark has noted, in terms of you can free up some of that space and increase housing stock relatively rapidly, as well as values. The downside is you can often end up with very sometimes dangerous, but also very unattractive bedrooms with no windows, for example, very, very small apartments. All the kind of abuses that you can imagine a dodgy developer would have a crack at if you were to work into that. So it's definitely a two-sided coin, but with sensible regulation and ensuring that it's safe and livable, it's definitely possible. And then the other side of that is in terms of just kind of knocking down and rebuilding. We're kind of very anti that for environmental reasons, yes, but also for kind of, to your point earlier, in terms of communities and stakeholders, if you can retain a structure for a few different reasons. One is environment and retaining carbon. Embodied carbon is one of the biggest environmental costs from building. Second is retaining heritage. Some buildings are pretty ugly, but quite a lot of it, especially in cities like London, is quite fine. So kind of where you can, retaining heritage. And then the third is retaining the people, kind of stakeholders and use classes. So if you had a favorite little convenience store that was on the corner, but the building is a terrible building, there is a way in which you can actually keep that little convenience store, expand and improve the existing building, but retain it in place rather than knock it down and then 3 years later have a supermarket move in, say.
I was curious about the role that public transport plays here, because obviously London has an immense and complex public transport system. I don't know, I haven't been to LA in a long time, what it's like these days, but
Still
it used
not
to be
great.
very car dependent. How does that play into the way people commute and whether alternatives would potentially work?
Well, I'm just going to add with LA. That's a good question, because the Olympics are coming up, and there are a lot of stuff going on with mobility in LA now too. I'm sure London also.
Good point.
So yeah, great question.
Art, what do you think?
I mean, I've got strong views on cars generally, but maybe I'll let Art dive in there, and then I'll say.
Well, yeah. So I would say, you take a city like Los Angeles, and I think the availability of public transportation is better than it was, when I was growing up here in the 1970s. And I think I was here for and went to a number of Los Angeles 1984 Olympic events. And the availability for public transportation at that time was quite limited. Today we have a subway system that continues to grow. We have, a bus system that is working better with dedicated bus lanes and the like. And at the same time, there is a resistance to taking public transportation, which I think is being reduced as newer generations of Angelenos are born and created, and they don't necessarily have that same passion for driving themselves that older generations did. And as more people move to Los Angeles from other places where they're used to, and in fact demand public transportation, so a large portion of our workforce take mass transport for at least part of their commute. They may do the park and ride thing, or they may, take, public transport for the last mile or the first mile of their journey kind of thing. And, we continue to look at ways that we can encourage that behavior. And we're still in the, kind of the subsidy model of that. And I think that's important. But I do think that there are cities, in the world that, where public transportation is just a substantial challenge. I mean, I think about Jakarta, where I am not infrequently, and the preferred way of getting around there is a scooter. And yeah, I guess that's more environmentally sound approach than a larger car. But there are lots of cities in the world where the public transportation infrastructure just doesn't exist. And so I hope Arthur has great cost-effective ideas to try to change that.
Challenge. There's a challenge. We have a challenge on the table.
Yeah. No, if we can come up with the route to stop the stranglehold on the car, that'd be fantastic. Just in terms of how the car-centric commute is, in my view, probably one of the worst things ever, I reckon. I mean, cars and roads take up between 75 and 90% of public space in cities. They kill, on average, 1.35 million people a year directly, and seriously maim 50 million more. And then the most likely thing to kill any of us on this call or anyone listening that's man-made is going to be directly a car or a disease that is car-related, i.e. from that. And it's the single biggest contributor to climate change, single biggest pollutant of air quality, noise quality, and light quality. So
How do you
the
feel?
car is really bad.
How do you feel about cars, Arthur?
Hey, I haven't said an opinion yet. Well, no, I have. It's more. These are just facts about that. We're probably going to, the most likely man-made thing to kill us is going to be a car, sadly. But so if we can move to active travel or public transport, that would be very good for us and our families in terms of, you know, not having a premature death.
You know, I agree with that, and I will say though that, you know, for the whole 40 plus minutes we've been on this call, we've really been talking about, you know, urban problems and urban planning, and I will just say I would probably be doing a disservice to my colleagues in rural health by not pointing out that, at least in the United States, that rural hospitals have enormous challenges of attracting talent to them, and for, you know, maybe the inverse reasons and challenges that we have in, you know, in large urban settings. And so rural hospitals are struggling to try to figure out how they can have enough essential workers who are willing to live in those communities. Now, housing is more affordable and all of that, but there are enormous challenges on that front as well. And, you know, and there, I think they're just trying to figure out, you know, how they can create the right environment to get these highly trained, highly specialized healthcare workers willing to move there.
I think obviously telehealth is playing a part in that. And if anybody watched Virgin River onto Netflix, you can get a sense of how they attracted somebody to their town as well. Or the other solution would be you have access to 2 amazing search firms right on this call to help attract those people.
There you go. That's great.
No, but it's a great point.
Who do you think has the bigger challenge, urban hospitals or rural hospitals, to attract and or retain?
Well, that's a great question, and I will say I can't help but probably take the tax lawyer's approach to this and say that, you know, you can't view those questions on a level playing field, and you have to apply relative weight to them. And I will just say, given that, you know, urban hospitals are serving more human beings, that urban hospitals have the more emergent challenge. But, you know, certainly rural hospitals will tell you, you know, they are really having a hard time with, you know, with the specialties in particular. And I get that on the one hand. On the other hand, we're talking about serving way fewer people. And so, and of course, I've chosen to live my life in cities. So, you know, I'm going to tell you that, you know, I tend to think that urban centers have the bigger challenge.
Interesting. So maybe one last question. So if you were to set aside all of the current limitations and name one thing that you think would allow essential workers to live closer to home, what would it be? Work closer to home.
I would say the resources to implement the kind of creative solutions that Arthur is describing. You know, for us, we think a lot about workforce housing, and yet at the same time, you know, we often scratch our heads and wring our hands and say, you know, we've got limited resources, and it's just hard for us to allocate those limited resources and implement them in a fair way across our workforce. And so if we had greater resources, we would be able, I think, to do the kinds of things that Arthur and his firm are advocating for and implementing.
Yeah, and I completely see that point. I don't think that it's the right ask of healthcare providers to become housing providers as well. As you say, it's both not your core business, and it's a huge economic stretch. And so it's probably looking at consortia, perhaps, or kind of ways of kind of collaborating it together. We've seen in the UK some successful examples of housing associations who are essentially kind of low cost or affordable housing providers working with different NHS trusts to provide housing near to where they work. So we're doing a project, for example, with UCL Hospital in London and with King's College Hospital in London, both of which work in partnership with different housing association providers. If I had a specific policy or ask, I think it would probably be some kind of, one that could be action tomorrow. I think it'd probably be something around a massive subsidy or incentive for active travel. The cost of that would mean that you could free up car parking spaces at hospitals. You could try and, by default, you're not going to be able to cycle 150 kilometers into work. So almost by definition, you're ending up living somewhere that is within a cycle. And also you obviously then have a healthier and more fitter workforce. And so maybe a policy around that, saying that you get X bonus if you kind of travel by foot or by bicycle X number of days per year, might be a very easy starting, or a relatively inexpensive and high carrot rather than stick starting point to try and get people thinking about it in a slightly different way. And they could see, actually, I might be able to bring home, I don't know, $5,000 more this year if I cycle for 100 days rather than drive, let's say. And that then into their calculation then means actually I can live somewhere closer to where I work, because I might pay a bit more rent, but I'm going to net that out. So something like that could work. But Art and others in the industry will have much better ideas and understand the practicality of them as well.
I wonder, how firms will often pay essentially a finder's fee if you refer someone who then gets hired by your company. Could you offer a finder's fee for hiring people who live within a certain proximity? In proximity,
yeah, love that. I think that's, or that you get a particular, is a more valuable, but kind of all things compared, a more valuable person who's kind of within shooting distance already.
Mm-hmm. Mm-hmm.
I love that on the one hand. On the other hand, I guess I can say this as a still an active member of the State Bar of California. Lawyers can ruin it for everybody, and as well-intentioned as what you just suggest might be, I wonder whether or not that point could be litigated.
Yeah,
from a discriminatory practice.
Yeah.
Which is a shame, actually.
Well, I mean, it doesn't mean it's not worth trying. I just can't help but look around corners and see plaintiffs' lawyers.
Yeah.
One of the things, and this is going to sound obvious, that we've been successful, whether it's food security in gardens and to people who how sports plays a part in bringing people together and different things, is you use the word consortium. There's a lot of young people that are coming up with innovative ideas on how to change things right now, and we've got to invite them into the conversation with wiser, I'm not going to say older, wiser people or wise people that and look for new ideas, like you've got, Arthur, and corporate A and corporate B and corporate C and nonprofit this and NGO that, and the healthcare systems sit down. This isn't a big revolutionary idea, and what's the goal? We need, and I know some of this happens, we need people downtown. How are we going to get them there? Who's it important to, et cetera, et cetera? Will they be happier? Will they be more diverse? Will people get to know each other better? Will they be happier? Because as we know in blue zones, they're happy because they belong to a community. That's the number one thing that fills their hearts and souls. And so how do we do that? And I know Cedars-Sinai has been, really effective in not just making people healthier and happier when they come to the hospital, but before they get there in the community, and things like that make a big difference. So, and hockey arenas, we need hockey arenas also. So
then everyone takes public transportation too. Absolutely.
So I'll pass it to Cynthia to conclude, but I just want to thank you all for being leaders who care about this and keep bringing the ideas to the table. And we'll have to get Cynthia and Arthur over here to LA and have a think tank meeting and do something like that. So
especially in the winter, right, for them.
Absolutely.
Yeah. Well, I think it's an amazing idea, and Mark, this podcast is a starting point for some of that conversation and consortium. And I know the work of the Innovation Foundation is around a lot of that stuff too. So yeah, looking forward to continuing the conversation offline as well.
Well, thank you, Mike. And now I'll pass it to you, Cynthia.
Sure. Thank you so much. This has been a fantastic conversation. We love these because they really are the start So hopefully the two of you will have a chance to have further conversations. We can loop back, and we hope that we'll be able to catalyze these interesting relationships that might then lead to projects or collaborations, or just to more people thinking differently. So pleasure to be with you all. Thank you, Mark, for hosting, and we hope to speak to you again soon.
Thanks, everybody.
Thanks for having us.
Thank
Thanks
you.
so much. Bye.
Thank you.